Hey, welcome to another edition of Meet the Authors for Voices of Innovation, Payer Edition. I have the book right here. It's coming out. So I want you to know what the book is about and meet some of the amazing people that helped create this book. And all the profits go to cure cancer. All the royalties from the authors go to cure cancer. So it's like a great thing. And actually, with you, Dr. Palackdharry, this fits right in, right? Because you're a medical oncologist.
I am.
Yeah. So tell us first, I want to know about your last name. So tell us about your last name and then tell us about yourself.
Well, my last name, at least the way it's spelled now, is Palackdharry. And we're the only Palackdharrys, really, well, we thought we were the only Palackdharrys in the world. Because when we came to the United States, you know how they changed the spelling of
Yeah.
people's names? So that's how we got our last name was Palackdharry. I was born in Guyana, South America, in village number 78. But I've been in the United States for many decades.
Wait, so they would number the village instead of like a name? You would
Yeah,
have a number.
Guyana used to be British Guyana. And so my heritage is Indian and Chinese. And, as the British Empire invaded the country, and then they became a democratic country in 1965. Yeah. And we left actually under political duress, as we knew the former, the Democratic president of the country. Yeah.
Right. Yeah. So you made your way over to the Americas and then you went to med school and you picked oncology, which right at the time, and maybe still today, I don't know the stats or anything. You could certainly enlighten us, but you definitely were pioneering as a woman oncologist, right?
Yeah. So somehow oncology seemed to pick me. And it was strange the way it all worked out. But I was a bench researcher in college, and I was doing molecular biology, molecular immunology in the area of cancer, and specifically in the area of how viruses can cause cancer. And was doing that. I always knew I wanted to be a physician. And I didn't really pick oncology as a profession. When I went to medical school, I thought I'd be a neurosurgeon until I realized there was no way that I had that kind of personality to put up with the hierarchy that you have to. And so when I was doing my residence, the University of Chicago oncologist knew of my molecular biology training and pushed me into it. And that's how I ended up here. It was great because I spent most of my career prior to going into the payer industry as a cancer researcher.
Yeah, very cool. Yeah, so tell us a little bit about what you're doing today, and then we're going to jump into your part of the book.
So I took a job recently, and I've been at this position now for 4 weeks at a new startup company called Curative. And this company has a very specific goal, and that is that they want to make insurance that is affordable with zero copay and zero deductible for all people who are insured. And right now it's all commercially insured. So it's a startup, and I am helping to build the program that will make this sustainable.
Very cool. That's very noble, and I hope you're very successful with it. It's very important. Tell us a little bit about your contribution to the book.
So I used to work for, and I have worked for many of the large payers, and I have been designing programs for the payers and also for specialty populations, high needs populations, people on Medicaid, people on Medicare, innovation projects. And they have to work and they have to be sustainable because we spend so much money on healthcare. And it became really personal to me once all the data started coming out of how inequitable outcomes were for people who are underprivileged or people of color. And certainly when I came to this country, our family was super poor until we could all, get on our feet. So during the time that I've known you and that all of this has been going on, my mom was diagnosed with breast cancer. And I am a breast cancer survivor. And I was diagnosed with breast cancer when I was 46 and treated and I'm 18 years out now. And when my mom came down with breast cancer, it was a neglected breast cancer. And she went into therapy and she ended up having a horrible experience.
Sorry.
She had no care management. She had no one reaching out to help her and to help her bridge that divide of how to reach people of a different culture or that might have different beliefs. And it was to the extent that I think there are still many people in this country who believe that male doctors are better than female doctors. And, I'm an oncologist, but to that extent, I couldn't help her. I had to be a daughter. She was insistent. So I watched her really die in agony. And it was really hard for me. So the opportunity to write this chapter or this, my thoughts on care management as I've been creating care management programs came from the experience that she had as a patient and that I've had as a patient.
Yeah. No, it's very heartfelt. I'm super sorry about the situation with your mom. I'm glad for you and your health and the journey, but you're right. Care management, we need a lot of transformation. So your contribution is really helpful into sort of shining light in that particular area. So I just want to thank you, Dr. Carol. It's easier for me to say it that way than your last name. I don't want to mess it up. For being part of Voices of Innovation, the payer edition. And as you know, and I know it's near and dear to you because of your own experience, definitely your mom's experience and your profession, that all the royalties will go towards doing more cancer research so we can eliminate cancer. So thank you so much for being part of Voices of Innovation. Meet the authors.
Thank you for the invitation and for what you are doing for all patients with cancer.
Hey, that wraps up another edition of Meet the Authors, Voices of Innovation Payer Edition. Thanks for watching.